You're listening to the WCEG Network on WCEGTalkRadio.com, the worldwide community empowerment group. Like us on Facebook, follow us on Twitter, follow us on Instagram, and you could even call in. And now, this is new, we are on YouTube Live TV, WCEG Network. You're listening to For Your Good. I'm Myrna Taylor Ransom, and our medical experts today are Nurse Pamela Davis and Dr. Charles So from the Morehouse School of Medicine. Our first hour, we talked about allergies and all of the pollutants in the air that we're allergic to and having allergic reactions to. I always call it pollergy because it's a combination of pollens and pollutants and allergies. Those things, they really send us into an allergic reaction, and I've been suffering from some of that myself. But now during the second hour, we're going to switch gears, talk about something that's really affecting a lot of us and at a higher rate these days, and that's colorectal cancer. Because it is colorectal cancer month in March, and we're down to the last few days, we needed to address some of those things that are prevalent in our systems and giving our people a hard time. And that is one of the diseases that's really on the increase right now. And I don't know, maybe because it's our diet, because colorectal cancer is cancer of the colon and the rectum. So, Dr. So, why are we seeing such a dramatic increase these days?
Okay, before we talk about why we see an increase, it's probably because we screen more. If you look for it, you will find it.
Yes.
But the colorectal, the rectum and the colon is part of your digestive system. When you eat, you masticate, chew food first through your mouth, and it goes down to your esophagus, then it goes down to your stomach. Then your stomach work on it and start breaking the food again. Then just after the stomach, you have the duodenum, and you start absorbing all the nutrients that most of the nutrients that you need. Then you continue your transit to the small intestine, and after the small intestine, you go to the what we call the large intestine, and the large intestine is the colon. You have still some absorption there in the large intestine, but also you start moving to from the large intestine, because you have three parts in your large intestine. Then you move to the rectum. Then you push it out. Okay. Here, this March is we want everybody to be aware of colon cancer, because it's kind of, I'm going to give you some numbers here about colon cancer. Just to say that on the cancer deaths, it's the second leading cause of cancer death. And I believe the first one is lung cancer. After lung cancer is colon cancer. But also, I'm going to give you the numbers in 2017. There was 500 cases, new cases of colon cancer, and also 39,900 cases of rectal cancer. That's in the United States. So if you look at, it affects both men and women, but also, like I said, we have on those cases every year, we have 20,000 men that die from colon cancer and 23,000 women. So you see, it affects both men and women that die from colon cancer. That was just this number in 2017. So you asked me why we have colon cancer? That's a very good question. It's difficult to say why we have colon cancer, but we know that if we get older, we increase our chance of cancer, mostly after age 50. The other things, it affect, like I said, it's not just men. There is more men than women, but it affects both men and women, and it affect all races, but mostly you have to pay. We African American, we paid a higher price because the mortality in African American is higher than in any other race. So I will encourage all brothers and sisters to get screened for colon cancer because we have more chances to die from the disease than other races. The other things that I would say also is a risk factor is what we eat. That's we people that eat more vegetables, that eat more fruit, that eat more fiber in their diet, and less red meat and processed food, has less chances of having colon cancer than people that have a diet high in processed food and high in red meat. There is also family history. You need to know your family history, but it's a random disease. But you still need to know your family history. If you have a family history of colon cancer between your brothers and sisters, dad, mom, close uncle, and auntie, you need to really be careful and be screened for colon cancer.
Yeah, so because the numbers are astronomical now, and it seems to be that there's a faster morbidity.
I'm sorry, what's the question?
It's a faster morbidity and mortality rate with
if
colorectal cancer.
Yes, and I think it's for all cancer. The earlier you diagnose it, the better it is. Yeah. If you because colon cancer, if you're gonna ask me what are the symptoms, and if I tell you the symptoms and you have those symptoms, it's already late. Okay.
Oh, wow. Okay. So then, what are the symptoms?
Women can feel even if they have mammogram and the mammogram is normal, they feel a little bump in their breast. They can just go and get it checked. But for colon cancer, you're not gonna feel a bump. And like I said, when you have symptoms, it's late. The symptoms is constipation. But remember, I don't say all of us are constipated, but there is a high rate of constipation in the U.S.
Yeah, and it could go unnoticed.
And it can go unnoticed, okay? Because you have a tumor or some swelling inside your colon, and so it's a obstacle. So that's why you have this. You don't want to wait to have that. The other thing is blood in your stools. If you start seeing blood in your stools, you can different blood can be very red. Most of the time, it's those hemorrhoids. So it's different when you have only blood when you pass your stools and you see some drops of, or you wipe, you see it's red blood, bright. So different than seeing your stool being dark, because that blood that been in your digestive system for a while, so it doesn't become red anymore. It become very dark. So you have those dark stools. The other things is weight loss. When you have cancer, or you start having some weight loss. You don't want to have those symptoms like jaundice, because it's already spread to your liver. You don't want to have bone pain in your bones, because it's already spread to your bones. You don't want to have spread to your lungs, if it's already spread, that's it's going to be hard to treat.
It's probably already metastasized.
Yes, that's what I said, metastasized. I wanted to use a later.
Which means spread.
Yes, it's spread, yes.
Good job.
That's what it is.
Good job.
Exactly.
So a lot of people are going to think when they're constipated, I better run to the doctor now.
Yeah. No, but I don't. You don't have to run to the doctor when you're constipated. But what I need to say, just drink plenty of.
Just get checked.
Get checked, but also drink plenty of water and eat your fruit, eat your vegetables. Make sure what you eat has a lot of fiber too.
So it's very important when your parents say eat your vegetables, eat your vegetables.
Yes.
Eat your vegetables.
Now I have a question just for the listeners. What if younger people are constipated all the time and their parents are trying to cook vegetables, or maybe they're not cooking vegetables, because a lot of this generation, or should I say, a lot of parents are working more for survival, and they don't get a chance to cook vegetables as much, and kids are constipated because they eat out a lot. Mm-hmm. So we don't want them to think that they're having colon cancer. So what's too young? We know we should start checking at the age of 50, but if you have a child that's constipated often,
now for kids don't have. I mean, you have to look at family history. Mm. But kids, if you're in the 15, 20, 25, most of the time you don't have colon cancer. Okay. The other factor that I didn't talk about is obesity. It's a risk factor for colon cancer. It's not everybody that have constipation have to go check for colon cancer. Absolutely not. But what I suggest is we have to make sure that we go to the basics and eat our vegetables and eat our fruit and drink our water, but also be active. People that exercise, I mean, your colon move with exercise. People that exercise have less constipation than people that have a sedentary life.
Yes, yes.
So
in other words, you're actually helping the body to move.
If you move your legs and walk, believe it or not, your colon start moving with you.
Of course, I know that.
If you sit on a couch and do nothing, your colon do the same.
Right.
Sit in the couch and do nothing, and you get constipated.
So, move that body, work that body.
That's exactly what they used to say. So it's best to do that.
It's best to do
Don't
that.
be a couch
all
potato.
around, because that helps your body stay active and it helps your organs stay active. And that sedentary lifestyle is not good. The sedentary lifestyle will not only make you a couch potato, but a sick couch potato.
Absolutely.
Yes. Very constipated. Very stuck. Yes, you're right.
And so then that's why the numbers are being raised on colorectal cancer, because of mostly sedentary lifestyle.
Yes, sedentary lifestyle. The other thing also that we didn't talk about is people that have what we call inflammatory disease of the colon, like Crohn's disease, ulcerative colitis. Those are disease of the colon, and also people that have some they have some type of abdominal pain due to acute diverticulitis. Also, those are inflammation of the colon. Also, those are risk factors. Increase your risk of having colon cancer.
So we do need to be checked out, once a year, or
no?
After 40 or after 50?
There are several recommendations. The general recommendation is to start being screened at age 50, but also they say for African American, because we are increased risk of colon cancer, to start be screened at age 45.
Okay.
Yeah.
So between the 40s and 50s.
Yeah,
right.
I would say between age 45 to age 50. Mostly if you're African American, you need to get screened. You don't get screened. There is different way of screening for colon cancer, because this is the problem. The problem is the polyp. Polyp is the small tumor inside your colon, and it's a benign tumor most of the time, and that tumor can become cancerous. It doesn't become cancerous overnight. It takes years for that polyp to become cancer. And most of the time, that polyp become cancer between 10 to 20 years. So knowing that that polyp become cancer between 10 to 20 years, so that's why you will see the recommendation for colonoscopy. One of the recommendation for screening for colon cancer, what we call the gold standard. There is other ways to do it, but the recommendation is to do a colonoscopy. The colonoscopy is you have to clean your colon the day before.
Nobody likes that test.
Nobody.
Okay.
I don't know of anybody that likes that test.
Yes, I'm going to say why people like that test. I have, because patients come to me and say, what is the best way to clean my colon? Or I want to do a cleansing. I'm going to be on the diet. I'm going to drink just fluid for 2 days because I'm doing a colon cleansing.
Right.
Okay, that's fine. While you're doing the colon cleansing and drinking all the fluid, get your colonoscopy. But you drink that fluid, it's the golightly. It makes you have diarrhea.
That thick stuff.
Yeah, you have diarrhea after taking it. But here is the catch. If I don't do it, I don't know if I have polyp or not because I cannot see it. Okay, I don't know if I have polyp. Then I'm going to bed worrying about colon cancer because it's a preventable disease. And every day I'm increasing my stress because the older I get and I don't do this test, I'm increasing my chance of having colon cancer. So I rather go drink my fluid, my gallon of golightly, have my diarrhea.
And it's a gallon of it, see?
Yes. And the next day, go get my colonoscopy under the GI with the gastroenterologist. Sometimes they put me to sleep. They give me that white milk they inject it, and I sleep well. They do the colonoscopy. You don't feel absolutely nothing.
Right.
After 30 minutes, you're awake. And what they're trying to do here, when they do the colonoscopy, is they go from the rectum, they push it toward your colon. You have a ascending part, a transverse part, and a descending part. So they push it from the rectum to the cecum. And what they look with the camera, if you have yes or no polyp. If they see a polyp, they cut it and take it out. So
Snips.
yeah, they snip all the polyp. So sometimes you don't have polyp at all, which is excellent. So your next colonoscopy is in 10 years. Remember, we say it takes 10 to 20 years for a polyp to become cancer. Okay? So if they remove all the polyp, if they don't see any polyp, you're good for the next 10 years. So now you can sleep every night without worry. If you don't do it, let me go back. If they see polyp, they cut it and they remove it and they send it to the lab and they look at what type of polyp is it. Most polyps are benign, and if it's they will call it a hyperplastic polyp, you're good for the next 10 years. It depends on the size of the polyp and the number of polyps too. If it's just 1 or 2 polyps in the small polyp, you're good for the next 10 years too. So now if you have a bigger polyp, so now because you're at increased risk, because those polyps, when they're bigger and when they're not hyperplastic, but let's say they are another type of polyp, you need to have a colonoscopy every 5 years. To make sure that because those polyps they can grow fast, you can have another polyp that grow, and those polyps become cancer. So this is a disease, colon cancer, that can be prevented by colonoscopy.
Okay, so now we see the reason to love to have a colonoscopy.
You sleep with a peace of mind. If you don't do it, you still have a cloud on you. You don't know where you're going. You don't know if you have it. You don't know if you don't have it. And like I said,
even if
don't
you're
wait.
at risk.
Don't wait until you lose weight. Don't wait until you see your stool becoming dark. Don't wait until you have constipation and abdominal pain to start coming to your doctor.
Because by the time you see the symptoms,
It's already
there.
And then you're in trouble. Then you have to
Yes.
have maybe cancer surgery or
Yes.
Chemotherapy, radiation.
Then you have chemotherapy. Then they go take your bowel, cut it, and put your bowel to your skin. They give you a pouch there until for a few years.
Yes.
Yes, and so that costs a lot of money. That costs a lot of disability. That costs a lot of stress. So go get your colonoscopy. So now, not everybody wants to do colonoscopy. We understand that. So if you don't want to do colonoscopy, there is other tests that you can do. They're not as good as colonoscopy, but it's better than nothing. So if you don't want to drink that liquid and have your diarrhea and get your colonoscopy, this is what you need to do. You need to sit on your chair at home where you do your stuff, number 2,
Right.
and take a sample of that number 2
Right.
and put it in that card.
I was going to ask about that.
The
I saw a
colon
commercial
guard.
on TV last
Colon
night.
guard.
Yeah, about sending your bowels to the.
Yes, because you don't want to have your colonoscopy. So we have to use other methods to do it. And
That doesn't sound like too much fun either.
yes,
I guess it's necessarily not fun, but
so what they're trying to look is trying to look some trace of some DNA of blood in your stools.
right.
It's not as good as colonoscopy, but it's better than nothing.
Better than nothing.
So since you talk about Cologuard claim that you need to do their test every 3 years. Okay, every 3 years you sit on your chair at home in your privacy.
the royal crown.
Yeah,
Throne.
and
The royal throne.
then you took some sample of your poo and put it there and send it to Cologuard, and they answer yes, no. Okay, what they said, the test is positive or the test is negative. Okay.
Okay.
The other test is the FIT test, is the fecal occult blood test. It's the same things than Cologuard too, but that one is done every year. You sit on your nice chair,
The royal throne.
yes, and take the sample and put it in that card and scratch it and close it and put it in the envelope, and you can mail it. Okay, and they answer you yes or no. The test is positive.
I know.
So here is
That's when you don't
here
want to
is
be a
the
mail
catch.
carrier.
If the test is negative, you can say okay. Is like I said, it can still have. It's not determined if yes or no you have polyp. Remember, it doesn't tell you yes or no if you have polyp, but it's better than nothing. Okay, so
Are they pretty accurate though in the testing?
like I said, it doesn't tell you
Oh,
if there is polyp or not because you cannot see the polyp.
right.
Okay.
Right.
You
There was
just
the camera there.
But it just says whether the poop is showing anything
yes, like some trace of blood, the DNA of blood, those type of things. Because
Anything
those polyps,
irregular that stands out.
those polyps bleed a little bit, okay, and they're trying to catch if you have a bleeding of one of those polyps. It's very microscopic. You cannot just trying to see a cell but you're trying to get the DNA. Okay, so that's when the test is negative. They say, okay, we don't see that you have some type of minor microscopic bleeding. Okay, so now here they say the test is positive. So when the test is positive, now you need a colonoscopy. That's what it is. It can be falsely positive, tests. Okay, you got your colonoscopy. It can be positive, really positive, and you have something else going on. It can be a polyp or it can be cancer.
But then it's necessary to get to the doctor at that point.
Yes,
Yes.
you definitely, if your test is positive, you definitely need to see your gastroenterologist and get your colonoscopy done.
Okay.
So if you go to the doctor and it's for the first time, you think he would do it the first time you go there?
No.
What's your age?
Just putting it out there.
No,
Maybe 40 or 50.
You
If
40
you go to the doctor, your primary doctor,
Yes.
you think he would do the
No, your primary care doctor will not do your colonoscopy. Your primary care doctor will refer you to a gastroenterologist to have your colonoscopy done.
I hope that answers your question. Because that's very important.
Yeah, you don't come on Monday, I'm going to see the doctor and have a colonoscopy because your bowels need to be prepared anyway
Right.
for that procedure. So you don't eat food that are like red, too many colors.
Right. Especially strawberry soda and
Yes.
those type of things to throw the
Yes.
test off, misreading.
Yeah, so you
The
need
red
to.
dyes, I should say.
Yeah, so eat something very like pasta, bland food, and just
Some nice, lovely chicken noodle
Yeah.
soup.
yes,
Stay away
Want
from the
things to
dye.
be as clear as possible.
Right.
yes.
And
No
they'll try
clam
to,
chowder.
they'll try to make you as comfortable as possible.
So there is another test that you can do. Is there's a blood test. No, not the blood test. The stool test. There's a colonoscopy. The other one is the CT. You know, they yes, a CT,
scan?
CT scan. Yes, what they do, you go get, and the CT scan is good for 5 years. Okay, I think it's good for 5 years. Yes, and you go there, they send air inside your colon, so
yes.
they can expand, put some contrast, and take a CT and trying to see if
CT stands for.
computed tomographic.
Which is taking a picture
Yeah,
on the
Just a
inside.
picture.
Yeah,
Right.
it's just a picture.
Right.
Okay.
Yeah, and they take to look for polyp. It's good for 5 years, but it's not as good as a gold standard, which is the colonoscopy. You get it one time,
And you're done for that 10-year period. if
and
they
it's
don't
good for
find
10 years.
anything.
If they don't find anything, it's good for 10 years. And if they find anything, still, you're not still in bad shape because now they remove the polyp,
Right.
they snip it, they've been gone, so you can sleep for the next 5 years.
And the CT scan, it just magnifies it.
Just worried about the
Time
bus
1000.
that might hit your house or one of you. Sorry.
Really?
He says, well, you'll sleep easy. Oh, yeah. That's one of the minus one
So
stressful thought.
Here, the problem here is to get people screened.
Yes.
And that's the terrible issue. I think if I look at the numbers of people being screened, if you look at a very early age, around 50, you don't people that screen is probably 40 to 50% of adults that need to be screened and really get the screening.
Well, I noticed if you have certain insurance, they give you little perks to go in and get your certain screenings.
Well, that could be an incentive.
They're kind of advertising that. And with that being said, are there any clinics?
Okay. Let me take it back because I have the real numbers here. If you look at the guidelines among adult 50 and older, that was in 2000. We have it was only 7% of adult age 50 and older reported having the stool test. There is another test that 60% that have either the colonoscopy or the sigmoidoscopy. The sigmoidoscopy is another test that also you can do. It's good for 5 years. Doesn't look the entire colon. It just look at one part of the colon. That's what
So
is
did
the
you
fast.
say 7 or 70?
No, 7% have the stool test, and 60% of adults have the colonoscopy or the sigmoidoscopy.
So we need to come up with a way to...
They say
We
again
need to encourage
between
all.
between age 50 to 64, 50% has been screened, and for 65 and older, 68% has been screened. So
That's of
in-
the entire population?
yes,
Oh, wow. So we need to encourage everyone to get a colonoscopy.
yes, and
Because
it's
colon
preventable.
cancer is
Preventable.
preventable.
And normally with the older seniors, it's kind of worked in and they make the appointments for them. So, with after so many years, but
You have to go to your appointment.
right, you do have to go. And
Don't just make it, but go to
right.
it.
And they normally have someone to carry them there or someone to pick them up, some kind of transportation. But just a wee bit younger, we don't even make the appointment. So we need to make that be more aware of.
But also, I believe it's due to access to healthcare, because the screening rate varies according to different states. Let's say in Massachusetts, where they have, I don't say almost universal healthcare, their screening rate is 76%. If you go to another state like Wyoming, it's 58%.
Yeah. And so the numbers drop
Yeah.
all across the country.
Yes, it depends of your state also.
What about Georgia? What's Georgia looking like?
That's a very good question. I don't have the rate. I'm going to look for the rate for Georgia.
Okay.
But
Let's see. That map shows Georgia. Is it high or low?
it's a high rate for colon cancer.
Oh, it's a
Yes.
high rate for colon cancer.
Yes, because also I believe it's the states that have it's the Midwest have a lower rate than Georgia has a part of the high rate. The states are in front of us are Mississippi, Louisiana, but Georgia. I have to look at the rate for Georgia.
Okay, Georgia, it's time for us to get serious about our colons.
Yes. We encourage everyone to go and get screened for colorectal cancer. That's colon. That's
And
colon
usually,
cancer of the colon and the rectum.
Usually, insurance pay for it. And the screening should be free because like I say, it's a life-saving procedure. Get your colonoscopy done, and that can save you from colon cancer.
Yes, maybe we need to do some research on it and find out what, I want to say schools like Morehouse or any other schools or community clinics, see if they have any free screenings or if they could, because they normally do, the vitals
Right.
or dental, but
Yeah,
this-
colorectal examination is a
Right.
little bit more intense.
It is.
Intrusive. So
Yeah.
they probably don't have a lot of places that do free screenings,
Well,
I mean,
free.
it's,
like at health fairs and things like that. You can't
no,
do it there.
you can. It cannot be done at the health
Right,
fair,
right.
because, like I said, it's done. Which is true, is intrusive. Most people get anesthesia during the procedure. It has to be done in the suite or with
It has to be done in private.
yeah, in with anesthesiology, and there is some risk.
It is.
Yeah.
Yeah. So that's one of those things that people don't really want to get, and you have to make a special effort, so it becomes a little bit more labor intensive. So I can understand why people won't get the exam, but It's a life or death matter. So it's something that we should do anyway. One of those things, one of those must do. That's on the
Yes.
must do
And the
list.
bright side, it's not like you have to have it every few months. It's like
Yeah.
once every 10 years.
Yes.
And 5 if something is found. So, and that's just a polyp. So,
Right.
it's not. It's like hold your breath and let's get it taken care of. It's serious.
It is serious. Now, if you find out your results come back positive, then what happens? You have to arrange some kind of treatment or
Yes,
surgery.
if the way the treatment, you need a biopsy. If they see something, they take a sample, the biopsy, and if the biopsy confirm the cancer, so the first thing is to do is to look at the type of cancer. Most of the time is adenocarcinoma, but you look at the type of cancer. But also when they look at it's not just looking at what type of cancer, but now there is a possibility to test what type of the genotype, what type of cancer, because they know the receptors in those cancer cells and what is the best treatment based on the histology and the response of those cancer cells. So they will determine. Plus, they have to determine if it's just localized, if it's just stay within your colon, or if it's like we said, we spread. You have metastasis. If it's spread to your bone, to your lungs, to liver. So they have to know how far, where is exactly is the cancer. So based on that. If it's mostly localized, you can have elective surgery. They remove it and put it back. If it's unfortunately, sometimes they cannot put it back. But most of it, if they cannot put it back, they'll put it back. But also chemotherapy. It's one of the treatment for less radiotherapy, but it's a possibility. But mostly chemo. Therapy to trying to control this cancer. But it's expensive treatment.
Right.
It's a treatment that lasts months, and you need a lifetime follow-up.
And
It's a
then,
lifetime follow-up with the cancer doctor because cancer can come back.
dealing with the chemotherapy, which is a very serious
Yes.
treatment, and it weakens the body as well.
Yes, absolutely.
The system, yes.
So that's what I said. Again, screening is the key. Removing this polyp prevent cancer, and we should not die from colon cancer.
And eat more vegetables. Drink more water.
Yes.
Drink more water.
Exercise.
Exercise.
At a certain time, they say also when you take aspirin, it can decrease your risk of colon cancer.
Really?
Yes, but we're not recommending everybody to start taking aspirin to prevent colon cancer because you have also increased risk of bleeding when you take aspirin. So eat your vegetables, eat your fruit,
Drink your water.
drink your water,
All those
Plenty of
good
fiber.
things. And stop
And
regretting,
decrease.
and
And
exercise.
decrease
and stop
the red
regretting
meat.
or resenting so much having to do those kinds of things because this healthy lifestyle.
It's a healthy lifestyle. It's not just for colon cancer. It's for any cancer, for breast cancer, for stomach cancer,
For
liver
diabetes,
cancer, for diabetes, for hypertension. It's the same. The way to prevent those diseases, there's no difference. It's exactly the same.
And like you said, if you're losing weight uncontrollably and you're not trying to lose weight
Right.
and you're losing weight and you're constipated, maybe. So can you be losing weight and not be constipated?
Yes, you can.
And that still
Yes,
need to be,
if
getting
you
checked out.
anybody that lose weight without and that is not by yourself trying to lose weight and something is happening, so you need to go check.
Something is happening.
Yeah.
And the best thing to do is go get it checked out.
Yeah.
That's the best thing.
The other things that we didn't talk to is sometimes we discover colon cancer by seeing somebody that is anemic. Your blood count
Wow.
goes very low because, like I said again, these are very small bleeding. The polyps bleed, and it's a very, very tiny bleeding. And you have this bleeding all the time. So you don't have anemia that just happened overnight. It's happening over several years. Then
Years of neglect.
yes.
Yes. And it
you-
is years of neglect if you're not getting
Yes.
it examined.
Yes, absolutely. And like I said, if we have an adult that have, for some reason, anemia that we cannot understand, we always go and do a colonoscopy.
Makes a lot of sense.
It does, and it's life-saving.
Yes.
And I know we all want to live long, healthy lives. I mean, who wants to live if you're not living your best life? You know?
Okay. Yes. The pollen.
Are you suffering over
Yes.
there?
It's getting
Well,
to
at least it's pollen and not a colorectal cancer. Let's measure it out here. So. But those have been our topics today. Those have been our topics today. We've had a great discussion here just now on colorectal cancer. That's cancer of the colon and the rectum. And we found out that the best way to prevent this disease is to go and get checked. Go and get your colonoscopy. Go and you can even do the colon guard, and
Yes.
I thought it's Cologuard.
It's Cologuard.
It is your
It's
colon.
Cologuard, yes.
Yes.
And see, you have to do the poop in the package and and send it to the doctor. It's not a very fun thing to do, but it's really important. It's necessary. It's life-saving. It's living your best life is to make sure that you are living your best life by being healthy. And exercise, eat lots of vegetables, drink lots of water, and regular checkups.
Tell the doctor the truth if you're actually constipated.
Yes. I didn't ask how does, and I guess this is it may be related or not, sex. And a lot of people are having rectal sex. So
Okay.
how does that? Is that impact?
Yes. Here is the catch. It's what we call HPV. HPV is human papillomavirus,
Okay.
and HPV is responsible of wart. It's responsible of cervical cancer in women. That's why we do the screening with the Pap smear, and also is responsible of oral cancer too. People that have anal sex definitely can be infected also by the HPV virus, and also that create trauma in the lining of the rectum and the anus. So with those trauma and the HPV virus combined, yes, it can. You definitely increase your risk of having rectal and anal cancer.
Wow.
Yes.
So
So I'm gonna talk something about too. There is something called the HPV vaccine. Okay. When we do a Pap smear in women, mostly after age. Let me go back. The HPV is a virus, and also the body can get rid of the virus. Okay, but sometimes it cannot, and that can give cancer. When we do a Pap smear, what we do, we just not looking at the cell, but we also test for HPV virus, if the virus is present or not. If the Pap smear is normal, the normal cells, and the HPV virus is negative, what we do, the recommendation, we say we do a Pap smear every 5 years. If you have HPV virus, even if the cells are normal, we're not doing a pap smear every 3 years, but we're doing a every 5 years, but we shorten it to 3 years because you have the virus, and the virus is a risk factor. So now there is what we call the HPV vaccine that we give to kids from age 9 to 26. And I think the recommendation have been even pushed to give it to past age 26. But here, we have a lot of resistance to give the HPV virus to children because parents believe they know that it's a sexual transmitted disease, the HPV. They don't want to. If we say we're going to give the vaccine to these kids, it's like we encourage them to have more sex and they can have sex safely, which is absolutely not the case. What we're trying to do here, like some disease has disappeared, like polio. So we're trying to vaccinate all these kids today so we can later on in the few generation get rid of the HPV vaccine. That is responsible, can be responsible of throat cancer, oral cancer, cervical cancer, anal cancer, and rectal cancer.
Okay. So then...
it's all about prevention.
Right.
That's
anal sex is not the most healthy type of sex.
I'm not going to... I don't
won't
know.
go that far.
Yes, but what I'm trying to say is just... I will strongly encourage people to wear condom and protect. That's protection. That's what I will encourage to do. I don't know what is
a latex condom, not just a regular condom, because those lambskin condoms are not as they don't prevent a great barrier.
I mean,
it's recommended by the CDC.
Yeah.
How about abscessi?
That's not my opinion. That was just, let me just correct that.
How about this? Let's just be absent.
It's recommended by the CDC that latex condoms be used.
Yeah, but some people are allergic to latex, so we have to also to be mindful to it. But any condom is still better than anything.
No, right.
And no condom.
I just say absent.
Abstinence.
I don't know about abstinence, but it's difficult. But
you don't know about it?
What I will say, we need, there is different type of protection. Abstinence is one of them.
Well, it is the safest.
It's the safest for sure. But also, if you cannot do abstinence, please wear a condom.
Please.
Okay. And so we're wrapping up our discussion today, but the colorectal cancer discussion has been just as interesting as the conversation we had earlier on allergens and pollutants in our environment, and how to try to stay healthy and keep from going sneeze crazy during this season of spring. I'm Myrna Taylor Ransom. My guests today have been Nurse Pamela Davis and Dr. Charles So from the Morehouse School of Medicine. We thank you both for being here and helping us with this discussion. Next month we will be back and we'll have some more interesting topics on living your best life. This is For Your Good on WCEG Network, on WCEGTalkRadio.com, and also live streaming on Facebook and on YouTube Live TV. Thank you for joining us today.